In this video, we are going to be looking at the topic arthroscopy. Hi, I'm Sharon. I'm working as an associate professor at Strickland College of Nursing. The following are the objectives that we'll be addressing in this video. Advances in technology have helped to keep orthopedic surgery on the cutting edge of medicine. This is particularly true for arthroscopic surgery. The word arthroscopy comes from two Greek words, arthro, meaning joint, and scopin, to look. Thereby, it literally means to look within the joint. Initially, arthroscopy was only used purely as a diagnostic tool. Now, with recent advancements, it can be used to perform intricate surgery as well. Arthroscopy is a minimally invasive surgical procedure to diagnose and treat joint problems. The common joints are knee, shoulder, elbow, hip, ankle, and wrist. In this procedure, the doctor uses an arthroscope, which will have a camera as well as a light source, which are inserted through small incisions. The advantage of this procedure is that there is less pain, the recovery is faster, and the scars are very smaller in compared to open surgery. Indications for arthroscopy procedure are ligament injuries, that is, anterior cruciate ligament or the posterior cruciate ligament. Cartilage tears can be meniscal or labral tears. Joint impingement, common in ankle, shoulder, or hip. Joint instability, common in the ankle or knee. Rotator cuff tears, common in the shoulder. Recurrent dislocations in the shoulder. Inflammation such as synovitis and bursitis. Arthroscopy can also be used to remove loose bodies of bone and or cartilage in cases of joint infections, in nerve compression syndromes, commonly carpal tunnel syndrome, and in chondromalacia, which is a wearing or injury of the cartilage cushion in the knee. Let's look at the steps in arthroscopy. In preparation, the nurse has to ensure proper patient assessment and that the consent is obtained. Site marking is done by the surgeon. Fasting status of the patient prior to the procedure. IV access, ensuring whether the line is patent. Regional or general anesthesia can be administered to the patient after consultation with the anesthetist. In the procedure of arthroscopy, small incisions are made around the joint and the instruments are introduced. Then the joint is distended with fluid for better visualization. The surgeon then inspects, diagnoses, and repairs through the process of shaving, suturing, grafting, or removal. This GIF shows various knee arthroscopic procedures such as ACL and PCL reconstruction, meniscus repair, meniscectomy, lateral release of the patella retinaculum, plica removal, microfracture surgery, autologous chondrocyte implantation, and osteochondral autograft transplantation. In closure and recovery, the joint is irrigated and the excess fluid is removed. Small sutures or steri strips are applied. Then the sterile dressing is placed. Then the patient is shifted to recovery room. Let's look in preoperative period. The nurse has the responsibility to educate the patient by explaining the procedure, anesthesia, and recovery expectations. The nurse has to ensure that informed consent is obtained. Psychological support has to be given to the patient to reduce anxiety. She has to ensure pre-op checklists are maintained, such as NPO status of the patient, the lab results, any allergies, any processes or jewelry is present, and whether they have been removed and handed over to the patient or patient related. The nurse also has a responsibility to prepare the surgical site. If necessary, shaving and cleaning has to be done. In intraoperative period, the circulatory and the scrub nurse come into play. Here, they have to ensure that the scrub nurse maintains the sterile field, assists with the instrument setup, Check the functioning of arthroscope, irrigation fluids, light source, and camera. The circulatory nurse has to see that the patient is positioned correctly, example supine with leg holder for knee arthroscopy, monitor the vital signs and assess the anesthetist, and count instruments and materials. In postoperative period, the nurse has to monitor the vitals, assess for pain, and look for recovery of patient from anesthesia. Ensure checking of circulation, sensation, and movement of the affected limb. Nurse has to maintain the limb elevation and apply ice packs if ordered. The mnemonic here is RICE, which stands for rest, ice, compression, and elevation. The nurse has to ensure appropriate wound care is given. The dressing has to be dry and intact. Splint application has to be done. Administer medications as per the doctor's order. Educate the patient on signs of infection, importance of physiotherapy, safe mobilization, and follow-up. And also provide discharge instructions on pain management, activity restriction, and rehabilitation exercises. The nurse has to watch out for the following complications. The patients also have to be educated for the signs and symptoms of these complications so that they will come back to us and inform so that necessary steps can be taken. And preventive aspects also the nurse has to keep in check. The infection, which can be seen as swelling or drainage from the wound, bleeding or hemarthrosis, thrombophlebitis can occur, nerve or vessel injury, which is manifested by numbness or tingling, which is usually temporary, stiffness or delayed healing, and change in skin color. The following are the references. Thank you for your patient listening.